So let's talk about social determinants of health. And in this case, we're talking about childhood poverty. Special thanks again to Dr. Beal for her slides. And we're going to talk what is social determinants of health and describe some of the local federal programs that might help with poverty. But I think that what's really important from a nursing perspective is that we stop and we really look at what are the family dynamics and what can be impacting that family's health, both from a psychological stress point of view as well as the environment. So again, social determinants of health are conditions or circumstances in which people are born or grow up in that can affect their overall health risks, and quality of life. And so in this listing we have social and community contacts, education, and that's not only family education but the schools that are in that particular community. Economic stability, is this a stable neighborhood? Are there sidewalks? Are there playgrounds? What availability is there for food? In this case, we're looking again at neighborhoods and what's in the environment. And there are many documentaries and news exposés looking at how particular neighborhoods were redlined, particular neighborhoods were deemed to have industrial companies there that then ended up polluting the groundwater. There have been schools built over coal dust and asbestos dust, which then cause significant health risks. So, and then again, looking at health and health care. So how accessible is health care? How accessible from a cultural and ethnic point of view is the health care that's available? So all of those factors really play into looking at the overall health of a family and in particular a child. There's a classic story about water in Flint, Michigan, which I won't go into a lot of details on, but essentially due to government policies, the water was severely contaminated with lead, which was then, that water was used to shower, bathe, mix infant formula, causing toxic lead levels in children, newborns and preschool and early school age children, which can have a profound effect on behavior and cognitive abilities. So again, clearly a very important aspect of nursing. So again, also looking at socioeconomics as part of that. Income, what's their occupation, what's the education level of the family. This is a brief video looking at two people who are of the same age. They're two white males, and yet what was the difference and how did it affect them from a healthcare and socioeconomic level. So it's interesting to watch. Income and health. So this again looks at poverty and race as well as the health of these children. And so you can see again when you are looking at poverty, what is the level of children who are healthy, and you can see that there is a significant difference between both Hispanic and Black, non-Hispanic, and white. So again, you can see that makes a huge difference. Education level and funding inequality. So poor families tend to generate lower tax bases, which tends to be, because of the way we do school funding, tends to make less money available for public schools in that particular area, which then, of course, generates poor student outcomes, and then, again, lower economic mobility, which then fosters the whole cycle again. So you can see how that is just an ongoing issue. So what are the interventions? Earned income tax credit has made a huge difference. It's lifted 3.2 million children out of poverty, and it is also an incentive for people to work. So again, in previous times, without this, there oftentimes was not as much of an incentive to work because you lost Medicaid, you lost also SNAP and WIC, you lost a lot of those support, federal support programs the higher your income went, but your income didn't go high enough to pull you out of poverty. So this has made a huge difference. You can see here the number of children lifted out of poverty through the use of SNAP. Educational programs have been a huge difference for children. Head Start, Early Head Start are all preschool programs getting children ready for kindergarten. Nurse Family Partnership is a national not-for-profit organization that works with state and local governments to help support families with nursing support. Reach Out and Read, again, helping provide books and other reading support. So again, community educational programs make a big difference. During COVID, we had additional funding, which really pulled children out of poverty. It fell to a low of 5.2% and kept 30% of African Americans and 24% of Latino children, kept them above the poverty line. Unfortunately, most of these programs, because the pandemic has resolved, now are being phased out. There was a lot of conversation about child support that went away, as well as housing support for rent that also went away. So it'll be interesting to see what happens with those numbers now. There's some case studies for you to kind of think through, and some discussion things for you to think through as well as you complete some of your other work, and that's it.